Good morning, boys and girls. I'll be taking CCRs or else criticize, correct, and relate the following prescription. I'll be taking CCRs or criticize, correct, and relate the following for you. So part one was taken by Dr. J. Babu, and then part two I'll be taking. So before I start CCRs, so you must have known how to write a prescription. What are the typical contents of a prescription? I'll not go to the details of that, but then I have told you in my previous class, that is in brackets of prescription, what are the contents of a prescription, what is body, what is transcription, what is superscription, what is subscription and all. So more or less, prescription has to be written over here, and then a question will be asked. Like for example, criticize and rate the following prescription of a patient of non-insulin dependent diabetes mellitus with mild hypertension. This is a question. So on the right, top right, there is address of the doctor, and on the left side, top left, you have the address of the patient. So wrong address or whatever will be given there or there, and then you need to correct the address and then the prescription part, which is also wrong. So you need to correct that, criticize that, correct that, and rewrite again. So let's enter into the world of CCRs. So criticize and rewrite the following prescription of a patient of non-insulin dependent diabetes mellitus with mild hypertension. So over here, the patient is NIDDM, non-insulin dependent diabetes mellitus patient, who has got mild hypertension. So on the right top, the address of the doctor. So whoever it may be, you can put any address or any person's name. So here, over here, Dr. T. Ravi, MBBS by MD, address Warangal, and his registration number, or you can put your name also, and your hall ticket number as registration number, and then contact number, and the date. Right. On the left, top left, you have name of the patient, Ishwaramma, age 50 years, sex female, occupation labor, and their address XXX. And the treatment aspect, so tablet, glibenclamide, 20 mg, 10 tablets. Take one tablet daily with breakfast. And then tablet propanol, 10 mg, 20 tablets. Take one tablet twice daily. Visit the doctor every week for dose adjustment, checkup, and refill of prescription. On the right down, signature of the physician, Dr. T. Ravi, MBBS MD. So this is what the prescription is given for you. So you need to correct the prescription, criticize it. You need to criticize it. Why glibenclamide is given here? What is the dosage of glibenclamide? So what is the drug of choice, or what is the drug to be used in a patient of non-insulin dependent diabetes mellitus with hypertension? So let's see. So criticism. So as you can see here, the registration number is missing. So here, the registration number of the doctor is missing, and patient address is missing. Okay, you can see the patient's details, the patient address is missing. And tablet strength of glibenclamide is wrong. It should be 5 milligrams, 5 mg. Right. Okay. And then the drug of choice, or the drug to be used in treating diabetes mellitus hypertension, is wrong. The reason being, since beta blockers have the property of masking the symptoms, like they are used mainly to treat hypertension. Apart from that, their adverse effect is they cause bradycardia. So the choice of propanol in treating this patient is wrong, because since it masks the symptoms of warning signs and symptoms of hypoglycemia, such as tachycardia, palpitations, tremors, and sweating. So what happens whenever you give glibenclamide to a patient, the drugs they tend to cause hypoglycemia. So these drugs, mainly beta blockers, they mask the warning symptoms of hypoglycemia, such as tachycardia, palpitations, tremors, and sweating. So if at all the patient complains of hypoglycemia. So the patient may present hypoglycemia in many forms, like he may complain of tachycardia. Sometimes the patient may complain of tremors, sweating, or vertigo, dizziness, so on and so forth. So these drugs, propranolol, mask the symptoms of hypoglycemia, like tachycardia and all. And hence, we don't advise propranolol over here. So the correct choice in this case will be AC inhibitor such as enalapril maleate, because it does not have the above adverse effects. And moreover, it retards diabetic nephropathy. So I think you must have got it. We don't use propranolol over here because it masks the warning symptoms of hypoglycemia such as tachycardia, palpitations, tremors, and sweating. And moreover, levanclamide prolongs hypoglycemia, or it prolongs propranolol prolongs levanclamide-induced hypoglycemia. So the correct dosage of levanclamide is 5 mg, and the treatment of choice in treating hypertension in this case is not propranolol. Rather, the correct choice is AC inhibitor, like enalapril maleate. And moreover, this drug, enalapril maleate, does not have much adverse effect, apart from they cause on long-term usage dry cough. So that is only the adverse effects of these AC inhibitors. And these drugs, they retard diabetic nephropathy. So correct prescription is Dr. T. Ravi, MBBS MD, address, Warangal, and a registration number, whatever you can put, contact number of your choice, and then date. On the left side, name of the patient Ishwaramma, age 50 years, sex female, occupation labor, and address Warangal. So now, let's see the prescription. So tablet, levanclamide 5 mg, 10 tablets. To be taken, 1 tablet with breakfast or before 15 minutes with 15 minutes breakfast. And when the drug to be used for hypertension is tablet enalapril maleate 2.5 mg, 10 tablets, because he is suffering with mild hypertension. So you can go with minimal dose of the drug to take 1 tablet daily and visit the doctor every week for dose adjustment, checkup, and refill of prescription. And then physician signature, Dr. T. Ravi, MBBS MD, registration number, whatever it is. So this is what it has to be written. So we'll see from the beginning. Okay, now you take down, I'll give you some time. Right? Okay. So take down, criticize and rewrite the following prescription of a patient of non-insulin dependent diabetes mellitus with hypertension. So Dr. T. Ravi, MBBS MD, address Warangal, registration number XXXXX, contact number, whatever, then date. Now the patient Ishwaramma, her age is 15 years, sex female, occupation labor, and the address over is missing, XXX. So you need to correct this address and then look for the prescription. So whatever the prescription is written, you need to comment on that, criticize that, and then you write the correct prescription, and that will do, right? So treatment aspect, tablet levanclamide, 20 mg 10 tablets, take 1 tablet daily with breakfast. Tablet propranolol 10 mg 50 tablets, take 1 tablet twice daily. Visit the doctor every week for dose adjustment, checkup, and refill of prescription. Physician signature, Dr. T. Ravi, MBBS MD, and then criticism. The registration number is missing, patient's address is missing, and then tablets of levanclamide is found. It should be 5 milligrams. So choice of propranolol in treating diabetes mellitus with hypertension is wrong, because it prolongs levanclamide-induced hypoglycemia. So it masks the warning symptoms of hypoglycemia such as tachycardia, palpitations, tremors, as well as sweatings. So the correct choice over here is an AC inhibitor such as enalapril maleate, because it does not have adverse effect apart from on long-term duration on usage or longer periods can cause dry cough. And this drug retards diabetic nephropathy. So correct prescription. So take down Dr. Ravi, MBBS, MD, address, and the registration number, contact number, whatever, and the name of the patient, Ishwarama, age 50 years, sex female, occupation labor, address Varangal, and then correct treatment. Tablet glaveneclamide 5 mg, 10 tablets, take one tablet daily with breakfast. Tablet enalapril maleate 2.5 mg, 10 tablets, take one tablet daily. Visit the physician or doctor every week for dose adjustment, checkup and refill of prescription. And then you have physician signature on the right bottom, and then name of the doctor, whatever he has studied, MBBS or MD, whatever, and then registration number, that's it. Now, criticize and rewrite the following prescription of a patient with acute attack of bronchial asthma. So the patient is suffering with acute bronchial asthma. Criticize and rewrite the following prescription of a patient with acute attack of bronchial asthma. So Dr. ABC, MBBS, address XXX, and date is missing. So name of the patient to the left side, XYZ. So name of the patient is missing, age 35 years, sex male, and then address of the patient is also missing, that is XXX. And the prescription part, we have the drugs of which are given of injection, aminophylline, 250 mg ampoules, 2 ampoules to be given. So 2 ampoules have been written. And then inhalation salbutamol, 100 microgram, 1 inhaler, 2 to 4 puffs followed by 2 puffs every 10 to 20 minutes with deep inhalation. Shift to routine treatment after the attack is over. Visit the doctor every week for checkup and refill of prescription. So as you can see in this prescription, you don't have the address of the doctor, and apart from that, date is also missing. And on the patient's aspect, now the patient is missing and the address of the patient is also missing. And then in the physician signature, right down bottom, the physician signature, Dr. ABC, MBBS, and his registration is missing. So criticism. So doctor, as I told you, doctor's telephone number is missing. Address is also missing. And then the sign RX is missing. Route and method of administration of injection, aminophylline, is not mentioned. So how do you administer the drug aminophylline? Has to mention over here clearly. So that is missing. And then 250 mg aminophylline is to be diluted in 20 ml of dextrose and infused intravenously slowly over 20 minutes to be repeated if required. When patient is prescribed inhaler, he must be taught to synchronize the actuation of inhaler with inspiration in order to maximize the delivery of drugs to the lungs. So the patient must be taught how to use the inhaler. Alternatively, instead of inhaler, the patient may be advised a spacer with which coordination between actuation of aerosol and inspiration is not needed. And the registration of the number of the doctor is not mentioned. So doctor's telephone number is not mentioned. The sign RX is missing. And then route of administration of injection aminophylline is not mentioned over here. Is not mentioned over here. And then 250 mg of aminophylline is diluted in 20 ml of 25% dextrose and infused intravenously slowly over 20 minutes to be repeated if required. When patient is prescribed inhaler, he must be taught to synchronize the actuation of inhaler with inspiration in order to maximize the delivery of drugs to the lungs. Alternatively, instead of inhaler, spacer may be prescribed. with which coordination between activation of aerosol and inspiration is not needed. So correct prescription. So Dr. ABC MBBS address has to be written over there. Telephone number has to be written. And then address, so whatever place, telephone number, whatever you're supposed to write, you can write there. Address also and date also. So injection aminophylline 250 mg ampoules, 2 ampoules. Injection aminophylline 250 mg 2 ampoules, 1 ampoule diluted in 20 ml of 25% dextrose infused intravenously slowly over 20 minutes. So 1 ml per minute, repeated if required. So inhalation, salbutamol 100 micrograms, 1 inhaler. 2 to 4 puffs followed by 2 puffs every 10 to 20 minutes with onset of inspiration. Shift to routine treatment after the attack is over. So physician signature, Dr. ABC, MBBS, registration number XXX. So that concludes the second question. And then third question. Criticize and rewrite the following prescription for a case of UTI due to E. coli pregnancy. So here the patient is pregnant and she is suffering with urinary tract infection. So what is the drug to be given in UTI? Criticize and rewrite the following prescription of a case of UTI due to E. coli. The patient is suffering with urinary tract infection which is caused by E. coli and she is pregnant moreover. So Dr. ABC address is missing, telephone number is missing, and moreover date is also missing. And now the patient XYZ, age 30 years, sex female, address is missing. So the prescription part of the drug which is prescribed is tablet cotrimoxazole, 28 tablets. Take 2 tablets twice daily for 7 days. Patient signature, Dr. ABC, registration number is missing. So criticism. So criticize and rewrite the following prescription of a patient for a case of UTI due to E. coli in pregnancy. Dr. ABC, address, telephone number, and then date, and now the patient, age, sex, address, and then the treatment. So tablet cotrimoxazole, 28 tablets, take 2 tablets twice daily for 7 days. And then physician signature, Dr. ABC, registration number XXX, 4X, XXX, whatever. So criticism. Over here, cotrimoxazole is not correct choice. Since sulfonamides, they tend to cause sulfonamides, the component part of cotrimoxazole, that is sulfamethixole, can lead to or may lead to kernicterus in newborn or neonates, and trimethoprim being antifoliate is associated with teratogenic risk. So they may cause neonatal hemolysis and methemoglobinemia can occur if given near term. Hence, cotrimoxazole is contraindicated in pregnancy. So you need to listen. I'll tell you once again. So in cotrimoxazole, we have got sulfonamide component as well as trimethoprim component. So the sulfonamide component, that is sulfamethoxazole, they may cause or they may lead to kernicterus in newborn, and trimethoprim being an antifoliate is associated with teratogenic risk. Can also cause neonatal hemolysis and methemoglobinemia can occur if given year term. Hence, cotrimoxazole is absolutely contraindicated in pregnancy. So the correct choice of drug in this case can be amoxicillin. So the correct prescription is Dr. ABC, whatever the address, you can write over there, telephone number of your choice, and date, you can write of your choice. And then now the patient XYZ, age 30 years, sex female, address of your choice, like Warangal, Hanamkonda, Parkal, Hyderabad, Delhi, whatever you can write. So treatment is capsule amoxicillin 500 mg, 21 capsules. Take 1 capsule 3 times a day. And then physician signature, ABC, registration number. Mind you, that is correct prescription, but in the exam, you are supposed to write the whole thing and then you need to criticize it and then write correct prescription. write correct prescription, that is everything is supposed to be written. And then physician signature, everything has to be written. Now, 14 or fourth question. Fourth question. Criticize and rewrite the following prescription for a case of typhoid fever. Over here, the patient is suffering with typhoid fever or enteric fever. And then on the right top bottom, on the right top, you have Dr. ABC MBBS, his address XXX, telephone number XXX, and the date. And then now the patient XYZ, age 30 years, sex male, and the address of the patient as XXX. So the drug which is prescribed for this case is tablet norfloxacin, 400 mg, 14 tablet. Take one tablet twice daily. So the patient was prescribed tablet norfloxacin. 14 tablets have been prescribed and advised to take one tablet twice daily. And then physician signature, Dr. ABC, registration number XXX. So criticize. Let's see what criticism has been made on this drug. So norfloxacin is less potent than ciprofloxacin. As such, norfloxacin is not used in typhoid fever. It is used in urinary tract infections as well as gastrointestinal disturbances. So norfloxacin is less potent than when compared to ciprofloxacin. It attains lower concentration in tissues and inhibitor concentration values for most gram-negative bacteria are 2 to 4 times higher than ciprofloxacin. So it is primarily used for genitourinary tract as well as gastrointestinal tract infection. So the drug of choice in this case is ciprofloxacin rather than norfloxacin. So correct prescription. So all of you take down the prescription part. Criticize and read the following prescription of a case of typhoid fever. And then Dr. ABC, MBBS, address, telephone number, date, and the name of the patient, age, sex, address. And then tablet norfloxacin, 400 mg, 14 tablets. Take one tablet twice daily. And then you have for the criticism. So norfloxacin being less potent than ciprofloxacin cannot be given. And moreover, it attains lower concentration in tissues and immunity concentration values for most gram-negative bacteria are 2 to 4 times higher. So the dosage to be given are higher when compared to ciprofloxacin since they have less MIC values or minimum inhibitor concentration values. So the dosage to be administered is quite higher when compared to ciprofloxacin. And they are generally used in UTIs as well as gastrointestinal disturbances. So the drug of choice or the drug which can be used in this case is ciprofloxacin. And the correct prescription is Dr. ABC, address, so whatever you can write of your choice. And then telephone number, you can write of your choice, and the date. The name of the patient, Ellama, Pullama, Malaya, Koshaya, whatever it is, Sadiq, Naveen, whatever you can write. And then age 30 years, sex, male, address of the patient, whatever the place of your choice. And then treatment aspect, tablet ciprofloxacin, 500 mg, 20 tablets. You take one tablet in the morning and one tablet in the evening for 10 days. And then you have got physician signature, and then Dr. ABC, registration number, you can write a whole ticket number, whatever. So this is what the correct prescription is. And then criticize and rewrite the following prescription for a patient who is suffering with meningitis which is caused because of Haemophilus influenza. So Dr. ABC, MBBS, address of the patient is XXX, telephone number is XXX, and the date is, of course, it's missing. And the name of the patient, XYZ, age 30 years, sex male, address XXX. And the drug which is administered for this patient over here is injections, cefazolin, 1 gram vial, 20 vials, 1 gram to be given IV 6 hourly. And then physician signature, Dr. ABC, the registration number XXXXXXX. So the question is, criticize and rewrite the following prescription for meningitis due to Haemophilus influenza. So age of the, what do you call it? address of the doctor on the right top, Dr. ABC, MBBS, and then address, telephone number, XXX, and the date is missing, of course. Name of the patient XYZ, age 30 years, sex male, and address is missing. So the patient was prescribed, the patient was put on injection cefazolin, 1 gram vial, 20 vials. The 1 gram was to be given IV 6 times. On the right bottom, you have physician signature, Dr. ABC, and his registration number is missing. So let's see what criticism says. What is the criticism? Since cefazolin being poorly, or it crosses very poorly into the brain, or it poorly crosses blood-brain barrier, and moreover it being a first generation, cannot be used. So the drug of choice for the drugs which crosses blood-brain barrier and are active against gram-negative bacilli are cefuroxime, cefotaxime, as well as ceftriaxone. Over here, cefazolin being a first generation, not as much potent as when compared to higher generations of cephalosporins. And this drug poorly crosses blood-brain barrier. So we need a drug which has got higher spectrum of activity and which can cross blood-brain barrier and has got activity against gram-negative bacilli. So drugs like cefuroxime, cefotaxime, ceftriaxone, or these are third generation. You can always opt for fourth generation also. So these drugs can be advised or the correct choice of cephalosporins, which are used in treatment of meningitis due to Haemophilus influenza or cefuroxime, cefotaxime, as well as ceftriaxone, since they can cross blood-brain barrier very easily. And number two, they are active against gram-negative bacilli. So these are the reasons these drugs are prescribed in such cases. So let's see the correct prescription. Dr. ABC address, as I told you before, you can write any address of your choice, and then telephone number of your choice, and then date also. And then name of the patient, whatever, Mastan, Ramesh, Suresh, Naresh, whatever name you can write, and age of the patient. So sex, male, address, whatever the case. And then, so let's see the correct prescription aspect. So injection, ceftriaxone, 2 grams vials. So 20 vials has to be given. 2 grams to be given IV 12 hours. The patient is prescribed with 20 vials, and that to 2 gram vials. The injection contains 2 grams of ceftriaxone, and the patient is prescribed 20 vials. So 2 grams ceftriaxone to be given IV 12 hours. But the ceftriaxone, I think they come as 500 mg, 250 mg, as well as 1000 milligrams, or 2.5 grams, or 2.5, 250 mg, 500 mg, or 1 gram vials. So 2 vials of 1 gram to be given. So 20 vials. So okay, maybe 2 grams may be available. So injection type ceftriaxone 2 grams. So 20 vials has been prescribed. So 2 grams to be given IV 12 hours. And then we have physician signature, Dr. ABC, your registration number, XXX, whatever. So this is how you treat a case of Haemophilus influenza. A patient suffering with meningitis caused by Haemophilus influenza. So the drug which was advised to the patient was cefazolin, if I'm not wrong. And then it is a drug which belongs to first generation, and it poorly crosses the blood-brain barrier and has got not much of activity against gram-negative bacilli. So what is the drug you are supposed to advise in such a case? Third generation cephalosporins, which have got activity against gram-negative bacilli, and then which can cross the blood-brain barrier very easily. They are like cefuroxime, cefotaxime, and ceftriaxone. So that is the correct prescription aspect. And then let's see the next question. So 16th question. So criticize and rewrite the following prescription. For a patient who has suffering with septicemia due to Pseudomonas aeruginosa. So Dr. ABC, so MBBS, address of the patient is missing. or wrong, whatever, telephone number is wrong, and the date, of course, is missing too. And the name of the patient is XYZ, and the age 30 years, sex male, and the address is missing. So over here, the patient is advised, or the patient is put on injection ceftriaxone 0.75 gram per vial, 15 vials. So 0.75 to be given IV 6 hourly. So have a note over here. He is prescribed ceftriaxone 0.75 gram vial, 15 vials have been prescribed, and then 0.75 gram to be given IV 6 hourly. Physician signature, Dr. ABC, registration and missing, of course, and then criticism. So the choice of drug over here is not to be given ceftriaxone, but then the choice of drug is ceftazidime or ceftriaxone, which has high activity against Pseudomonas aeruginosa. So you are not supposed to give, or the choice of drug ceftriaxone is not to be given because they are not active against Pseudomonas. So the drugs which are to be used, or the drugs which are to be prescribed in such a case are ceftazidime or ceftriaxone, since they have got high activity against Pseudomonas aeruginosa. So the patient is suffering with septicemia because of Pseudomonas aeruginosa. He or she must be kept on ceftazidime or ceftriaxone. And then correct prescription, Dr. ABC, BBS, address XXX. So whatever the address, you can write your choice. And then telephone number and then date. So now the patient age, 30 years, sex male, address, Anamkonda, Chaurasta, Warangal Chaurasta, Pochamaidan, whatever. And then treatment, injection, ceftazidime, 2 gram per vial. So is prescribed in injection of ceftazidime 2 grams per vial. 20 vials have been prescribed. 2 grams to be given IV 12th hourly. So high dose of ceftazidime has to be given because the patient is suffering with septicemia. And then physician signature, Dr. ABC, registration number XXXX. So I hope you have taken it. So let's move on to the next question. Criticize and rewrite the following prescription for hypertension in pregnancy. So over here, the pregnant lady, or the female is suffering with hypertension, and moreover, she is pregnant. And then Dr. ABC and BBS, address of the patient, of course, is missing, and then telephone number is missing, and the date is not given over here. So now the patient is XYZ, and then age 30 years, sex female. Of course, the address is missing as well. So over here, what is the drug which is advised or prescribed for the patient? So the drug endorphin maleate 5 mg, 60 tablets have been advised. Take 1 tablet twice daily. And then physician signature or ABC, registration number is missing as well. So let's see the criticism aspect or criticism part. So choice of drug in such a case of pregnancy with hypertension is wrong. ACE inhibitors are highly contraindicated or obsolete in pregnancy because of the risk of fetal damage and growth retardation. So what are the other drugs which are available or which can be advised to a pregnant lady in hypertension? The drugs safe in pregnancy are hydralazine, alpha-methyl dopa, dihydropyridine. Of course, calcium channel blockers can also be given, although they are safe. They may interfere with uterine contractions during labor. So the safe and sound drugs which are to be given in pregnancy with hypertension are hydralazine as well as alpha-methyl dopa. The correct prescription is Dr. ABC, BBS, address, you can write your choice, and then telephone number 2, and then date of course. And the name of the patient, XYZ, age 30 years, sex female, address XXX. So the treatment. So we were advised, the patient was advised endorphin maleate, so that is a wrong drug. The drug has not to be given. The drug ACE inhibitors are not supposed to be given in pregnancy with hypertension. So the drug which are supposed to be given in pregnancy with hypertension are alpha-methyl dopa and hydralazine. So tablet alpha-methyl dopa, 2 mg 60 tablets. Take one tablet twice daily for 30 days. Visit the physician after 30 days for refill of prescription. So physician signature, Dr. ABC, registration number XXX. Okay, take it down, right. Criticize and rewrite the following prescription for Parkinsonism caused by long-term usage of antipsychotics. So here the patient is suffering with drug-induced Parkinsonism, and the patient was put on antipsychotics for a longer term or for a longer usage. So he's suffering with Parkinsonism, which is drug-induced because of antipsychotics. And then Dr. ABC, MBBS address, of course, is missing, and then telephone number 2, and then date as well. So another patient XYZ, and then age 50 years, sex male. So the patient was put on levodopa 40 mg, 120 tablets. Take one tablet, 6th hour. And then physician signature, Dr. ABC, registration number XXX. So the patient is suffering with Parkinsonism, but then it is drug-induced in nature. So the patient was put on levodopa 40 mg, 120 tablets. Take one tablet, 6th hour. And then physician signature, Dr. ABC, registration number missing. So address of the patient is not mentioned. So you need to correct all those things, whatever it is. And the choice of drug is wrong. Since levodopa is not effective in drug-induced Parkinsonism. So here, Parkinsonism is caused because of drug-induced, that is because of usage of antipsychotics. So you need to give which can correct the situation. So because dopamine receptors are blocked by antipsychotics. So over here, the dopamine receptors are blocked by antipsychotic drugs. So drugs useful are centrally acting anticholinergics. So what are the drugs which are supposed to be given to this patient are not levodopa, but the drugs which are centrally acting, and moreover they are anticholinergics. Anticholinergic centrally acting drugs has to be advised to such a patient. So correct prescription is Dr. ABC, MBBS, and then its address XXX, telephone number XX, whatever, date. So now the patient XYZ, age 50 years, sex male, address has to be written. And then tablet benzoate salt, 2 mg, 21 tablets has been advised, has to be given, and then take tablet thrice daily for 7 days. So visits the consultant after 7 days. So physician signature, Dr. ABC, registration number XXX. So that is how you correct the prescription, that is how you write drugs to a patient who is suffering with Parkinsonism because of drug induced or because of long-term usage of antipsychotics. So here you cannot advise levodopa. It's not the drug of choice. It's not to be given. So we need to, because you need to use central acting anticholinergics. Criticize and rate the following prescription for a lady suffering with constipation, for a pregnant lady suffering with constipation. So Dr. ABC, address missing, telephone number is missing, or not the date of course. So now the patient XYZ, age 30 years, sex female, and address is also missing. So she was advised tablet bisacodyl 5 mg, 2 tablets. Take one tablet at bedtime. And the physician signature, ABC, and the registration number, whatever it is. So for criticize and rewrite the following prescription for constipation in pregnancy. So she was advised bisacodyl tablets, 1 tablet 5 mg, 1 tablet at bedtime. So what is the correct prescription? Criticism. So sign RX is missing, a superscription is missing. Choice of drug is wrong because bisacodyl being a stimulant purgative, which is contraindicated in pregnancy, and it may stimulate uterine contraction. So bisacodyl should not be advised to pregnant lady since it can cause uterine contractions and can lead to abortion or premature labor. So the choice of drug is an emollient or a lubricative purgative like liquid paraffin has to be given. So bisacodyl cannot be given. The patient has to be given a lubricant purgative like paraffin. So the correct prescription is Dr. ABC. Address has to be written, whatever you like, your choice, and then telephone number and the date. And of course, name of the patient has to be written, age 30 years, sex female, weight 65, and the address also. Let's see the correct prescription. So liquid paraffin 60 ml one bottle is advised for the corrected prescription. Take 3 teaspoonfuls or 15 ml before retiring to bed. And then patient signature, Dr. ABC, the registration number has to be written. So that concludes the CCRs. So I will tell you again, once again. So a prescription is being given which contains a wrong address, maybe a wrong telephone number of the doctor, or the name of the patient is not given, or the address of the patient will not be given. And the prescription which is given to the patient will be wrong. So you need to correct the address, and then you need to criticize the prescription part, and then you need to correct the correct prescription. So that is how you're supposed to write in examination form. So that concludes CCRs. I hope you understood it right.